Next up is the surgery set. So first off, you need some sort of extraction forceps. These come in all shapes and sizes, and I have a few other variations here. This is a good general one for most teeth. This one has a smaller head, and it also has diamond coating here, so it doesn't slip as easily. And this one is for root tips. It has a very sharp, pointy head here, so you can get those little root fragments out. I recommend that you keep, a handful of these in different sizes and shapes, so you are sure that you can grab a hold of whatever you need. So next up is our luxators. These two are called stubby handle luxators. These are from IM3. They're very strong and very sharp. This one is a 2mm luxator, and this one is a 3mm. So I found that these sizes are enough for most extractions. You may want to go bigger in size for larger teeth. These are elevators, winged elevators. So winged elevator, as the name says, it has a winged tip. It's typically more bulky, and you can put pressure. You can use those for elevation, whereas luxators are used to cut periodontal ligament fibers, but these elevators are used to elevate, so twist. And these are good for big canine teeth. So you want to keep different types of elevators, luxators, so you are prepared for any tooth you need to extract. Next up is some scissor. This is just a regular scissor used for trimming tissue, and for blunt dissection it has a soft end, so it's really good for blunt dissection, cutting tissue, releasing those flaps. I keep one of these scissors, but I also have a different type of scissor, which is very nice. This is curved, so it's easier to get a good angle when cutting gingiva. And this has a sharp end, so this is a really nice scissor. Next up is the periosteal elevator. So a periosteal elevator is used to release the gingiva off the bone, like this. And it has a big end and a small end. Next up is some tweezers, so forceps, pin set. And I recommend the 2x1 looking like this, because it's less traumatic. It will grab the flap without crushing it. Next up is a needle holder. Mine is combining a needle holder with a scissor, so I use that to cut the suture. I think that's very helpful. Next up is our scalpel holder. So I recommend you to get a round scalpel holder, because it's easier to navigate, to cut around the teeth instead of having a straight one that doesn't fit very well in your hand. So it gives a better ability to do more precision work. This one is a periosteal elevator, but for cats it's much smaller, has a straight end, and it's useful to have a small periosteal elevator for smaller animals compared to this very big one. And finally we have like a spoon curette, and it is sharp here, so we use that to scrape out debris, dirt, granulomas inside the alveolus after extracting teeth. So make sure you clean out the sockets with this one after you extract the teeth. So that's what I keep in my set, and if you see in my drawer here. And as I said, I recommend that you keep similar sets ready to go. So just buy 3 or 4 sets so you don't have to waste time cleaning in between patients. Same goes with the examination and cleaning sets. You need 1 of each for 1 patient. These needs to be sterile. You cannot use the same instrument for a different patient, not because it's crucial to keep sterility, but you don't want to transfer virus or disease, especially from one cat to another.